BPH is a condition that basically affects about half of men over 50. And so that's a lot of people we deal with coming into the office with this problem. Most of the time we're really dealing with the symptoms of BPH more than BPH itself. You can have quite a large gland without having symptoms, but when gentlemen start having irritative symptoms such as frequency, urgency, or nocturia, which is getting up at night multiple times, or if they have obstructive symptoms such as a slow flow, pushing to urinate, or dribbling at the end, they're having the symptoms of BPH. Men have enlargement of the prostate without doubt to a certain degree. However, it does not affect everyone, and there are many men who have no symptoms, even with a very large gland. But as you age, your prostate probably does enlarge somewhat due to the presence of testosterone or an isolate of testosterone called dihydrotestosterone. Also, there are some increased cells inside the prostate which make it a little tighter. Those two factors are what drive medical management, both to shrink it down and to open it up to allow men to urinate more effectively. Medical management usually involves starting them on a medication to help open it up called an alpha blocker. Now, there are many alpha blockers on the market, some of which may be more effective for some men than others. There are also drugs that are out there designed to shrink the prostate down slowly over time. There are other medicines that are out there, however they're not used as frequently. In addition, men often ask about over-the-counter supplements. Unfortunately, there has been very scant research done on some of the supplements. We do have some men who get anecdotal responses, and we do have some men who truly benefit from them, but we don't always recommend them because they are not predictable. Up until about 30 years ago, if a gentleman walked into the urologist's office with standard symptoms of frequency, urgency, getting up at night, and slow flow, they would get a TURP, a transurethral resection of the prostate, or a roto-rooter as it was affectionately called. Though the TURP is still a very good procedure, we have multiple techniques we can now do to address this enlarged prostate. That would include some of what would be considered minimally invasive therapies and what we do very commonly these days, which is a laser version of the TURP. There are several different lasers on the market to address the prostate. What we like about the lasers generally is that we get a gentleman out the same day with a catheter that comes out the following day, and that though he may have some symptoms for the first several weeks, symptoms do improve relatively rapidly. Most of these men are able to come off of their medications, hopefully for good, though it is possible the prostate can still regrow and we may have to do it again in the future. Overall, when a gentleman comes in with their complaints, we try to start simply. We try to get a good gauge of what's bothering them the most. Many of the symptoms they have, the frequency and the getting up at night, can be from other problems, and we have to rule that out, such as diabetes, sleep apnea, and similar conditions. However, most of the gentlemen either start on a medication or address this and look forward to some other form of intervention.